Have you ever wondered what really happens when an insurance company says no to a medical bill? Well, in this explainer, we're going to tackle some of the toughest, most confusing parts of medical billing. Everything from denied claims to the super complex rules that everyone in the system has to follow.
So here's our game plan. We're going to start with that super frustrating moment when insurance denies a claim, and then we'll decode why that happens. After that, we'll look at how providers actually follow up to get the money they're owed. And finally, we'll cover the major rules that govern this whole process. All right, let's get into it.
Okay, so let's jump right in with the thing that drives both patients and providers crazy, a claim that doesn't get paid. But it turns out not all unpaid claims are created equal.
Now, this might sound like we're just splitting hairs, but in the world of medical billing, this is a really crucial distinction. The difference between these two words actually dictates the very next step you have to take.
Okay, think of it like this. A rejection is kind of like sending a letter that gets returned because the address is wrong. The post office never even tried to deliver it, right? You just made a typo, so you fix the typo on the envelope and send it again. Simple. A denial, though, that's like getting a certified letter back stamped "delivery refused." The message was received, it was opened, it was read, and they officially said no. That needs a completely different approach.
So let's keep building on that. Once a claim is officially denied, the next step is to figure out why. Because you guessed it, not all denials are the same.
You can think of soft denials as temporary roadblocks. You can usually navigate around them. Maybe they just need a bit more paperwork. But hard denials, they're more like a solid brick wall. These are final decisions that you can't just fix with a quick correction. You have to formally challenge them with an appeal.
Now, a technical denial is all about a mistake in the process, not the medical care itself. For example, maybe the provider missed the filing deadline by just 1 day, or they forgot to include an authorization number. The medical care was perfectly fine, but the paperwork wasn't, and so, denied.
With a clinical denial, things get a lot more serious. This is where the insurance company is basically disagreeing with the doctor's medical judgment. They're saying, hey, we don't think that service was actually necessary, or sorry, that's just not covered under this person's plan. As you can imagine, these are often the toughest denials to hide.
And gosh, there are just so many reasons a claim can get denied. It could be a simple coding mistake, or maybe they forgot to get a prior authorization. It could be a missed deadline, sending the same claim twice, or the service just plain wasn't covered. Each one of these needs its own unique fix.
The good news is there's a clear process for fighting a denial. The first step is usually something called reconsideration, which is often just an informal phone call. If that doesn't work, you can escalate to a formal, written appeal where you provide all your supporting evidence. And sometimes, for simple errors, all you have to do is submit a corrected claim.
So what happens to all these claims that are denied, delayed, or just plain unpaid? Well, they enter a whole new phase. Let's take a look at how healthcare providers manage this big bucket of unpaid bills.
Think about it. Every single service a provider performs creates a little IOU from either an insurance company or a patient. Accounts receivable, or AR for short, is just the grand total of all those IOUs. Being able to manage and collect this money is literally what keeps the lights on at a hospital or clinic. Of course, you can't just have a giant, messy pile of unpaid bills. You've got to organize it somehow. And that's where the aging report comes in. You can think of it like a financial to-do list, but it's organized by how urgently each bill needs attention.
This report is how providers prioritize who to call first. They sort all the bills into these aging buckets. Anything under 30 days is still pretty new. But once a bill hits that 60 and then 90-day mark, it becomes a top priority. Why? Because the older a bill gets, the less likely it is that it will ever get paid.
So this kind of shows the whole journey of an unpaid bill. It starts as an outstanding balance. Then the provider's team will follow up. If that doesn't work, they might move to collections. If all of their efforts fail, it could even be written off as bad debt. Or, on a positive note, they might work with the patient to set up a payment plan. All right, let's zoom out a bit and look at the really important principles that govern this whole process. See, to handle patient information and billing the right way, you have to play by a very strict set of rules. It's all about making sure everything is handled legally and ethically.
You've almost certainly seen the word HIPAA on forms at your doctor's office. This federal law is really the bedrock of patient privacy in the U.S. In billing, it means every single piece of information, from a diagnosis code to a patient's address, is protected. Just talking about a patient's bill in a public hallway could be a huge violation with serious penalties.
At the end of the day, compliance is really all about staying within the lines. It means following all the rules from all the different sources: federal laws, state laws, even the specific policies of each insurance company. The main goal is to build up a shield of best practices to avoid legal trouble down the road.
Okay, these three terms often get confused, but the differences between them are massive. Fraud is the most serious. It's intentional deception, like billing for a surgery that never happened. Waste is more about unnecessary costs, like ordering the same lab test twice. And abuse? Well, abuse is kind of in the middle. It isn't necessarily intentional, but it represents actions that lead to improper payments.
There are a few other key concepts that keep the whole system in check. An audit is when an insurance company formally reviews a provider's records to check for accuracy. And on the patient side, a signed consent form gives permission for treatment, while a release of information form gives the patient control over who gets to see their private health data.
Whew, we have covered a lot of ground here, from the tiny details of a single denied claim all the way up to the huge legal framework that surrounds all of healthcare. So let's boil it all down to the most important points to remember.
When you really look at the big picture, you can see how it all connects. Denials aren't dead ends, they're just puzzles that need to be solved. Accounts receivable is the engine that keeps the whole financial system running through persistent follow-up. And all of this happens within the essential rulebook of compliance, which makes sure everything is done correctly and ethically.
It's a system with a lot of interlocking gears, and it's all designed to protect patients and make sure providers are paid correctly. But there's always room for improvement. Understanding how this machine works is the very first step to figuring out how we can make it better. Thanks so much for joining us for this explainer.